The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, the regenerative power of fat grafting. With us, we have an expert on the topic, board-certified plastic surgeon in Beverly Hills, Dr. Larry Koplin. Dr. Koplin, welcome to the program.
Pleasure to be here, Randy.
All right, now before we get into today's topic, big topic, I have a lot of questions for you. Now, I interviewed you probably about 8 or 10 years ago, and I called you, or I emailed you. I wanted to get you back in here, and I said, what's new? What's changed in the last 8 years, 10 years with you?
Big
and
change.
Immediately, it was the fat. So
yes.
Tell me a little bit about this. Fat transfer, what's it called? Fat transfer, adding volume to the face?
We call it fat transfer, we call it fat grafting, we call it fat injection or lipo injection. But fat transfer is really the best, most descriptive word, because it's realizing that as we get older, part of us gets fatter, but part of us doesn't. And this part of the face is where we lose our youth. You think of babies, of puppies. They have nice, round, fat, pudgy faces. They're cute. They're young. Their skin is plump. They look adorable. They look huggable. As we get older, the main thing that's really different between the last time I saw you and now is the fact that we really, truly understand the anatomy of aging, and the big anatomy loss is the volume loss, and the cure is really the search to try to find the best permanent, most natural replacement for what we lose as we get older.
Okay, so now you don't use Restylane.
I do
or
not
Juvederm,
use Restylane. I
guess it's called, and things like that. Why is that?
I'm anti-filler, and I know there's a lot of people that disagree with my philosophy and aren't particularly happy about my philosophy, particularly the companies that make these fillers, because...
But you're anti-synthetic fillers or whatever they are?
I'm anti any filler that is not what is supposed to be, which is fat.
Okay.
Fillers are trying to be fat. Why? They're trying to restore volume in the face. They're trying to fill wrinkles. They're trying to make people, give them that puppy face, give them that young baby face.
All right.
How do we do that? You have to put something in the face. How many fillers are there right now? Glad you asked me.
Okay.
There's over 100 different fillers made by hundreds of companies. And they're all trying to do one thing, which is to be fat. They're all trying to restore volume in the face. How many different types of Botox are there? There's one, now there's two. There's a Dysport and a Botox. Dysport is almost the same thing as Botox. Why aren't there 100 different types? Because they work. They're fantastic, and there isn't anything better, and they're not trying to be something different. My practice, people come in, they say, I want some fillers, I want a little this. I go, let's sit down and think about what the best thing is for you. What's the safest thing for you? What's the smartest thing for you? What's the most long-lasting thing?
Adding fat opposed to those others, does it do a better job?
It
looks
does
better?
A much better job.
And it's less expensive. I mean,
absolutely.
It's your own fat, right? Okay.
There's no fat like your own fat. And once I let people understand that there's nothing better than taking something that you don't need in a certain part of your body and moving it to a place where it has a wonderful benefit, they're sold. I don't have to sell it. I just have to describe it to them.
What's the most popular place? Under the eyes?
Most popular place is here for aging. And then usually if people need it in this area, they'll also need it under the eyes.
Okay, you do a lot of under the eyes?
I do more than anyone I know.
Anticipating this interview, I asked around. A lot of guys, plastic guys in particular, are afraid of under the eyes.
They're afraid.
They don't like to touch the area.
The reason is...
And what is it? What's your take?
The skin here is thick. The skin under the eyes is paper thin. So if you're putting something under paper thin skin, you have to be very good at it. And you have to be confident. And you have to have a lot of experience. And how do we learn? We learn by mistakes. And once we go through the learning curve, I'm sailing through. I'm very confident and very comfortable. And really, there's nothing better. There's no substitute for the lower eyelid by filling it with anything other than fat. But not just the lower eyelids. We'll see people come in with very hollow upper eyelids. Either they've had a lot of surgery or they just have natural sunken low eyelid volume. And people look old when they have
Interesting,
deep volumes.
really.
People look cadaveric. They look tired.
Like skeletal.
They look skeletal. And taking a little fat and just rounding the orbit area with it, particularly under the outside of the eyebrow, does a lot of things. It makes the eye look less prominent. It makes the depth of the crease look less severe. It even has the ability to hold up or lift the eyebrow. You can get a tiny bit of a brow effect.
How long can it last?
The wonderful thing about fat transfer and the power of fat is that it's permanent.
Is that right?
Restylane, Juvederm, fillers are temporary. They're designed to be that way, and that's one of the many things that's the negative part about them. Fat is natural. It's like a hair transplant. If you get a good hair transplant on someone, whether it's good or whether it's bad, it's there forever. And it's like planting an evergreen tree. If it takes, it's forever.
Okay, so hollow over the eyes.
Correct.
Add volume.
Add volume.
Very nice.
Cheeks. If the cheeks start to become thinner as people get older. Not always, but we have to be very precise about looking at their pictures and seeing if they've lost volume in the cheeks. This is absolutely the most critical area.
What the area is right there?
What we call the nasolabial folds, where we call the corners of the mouth, what we call the marionette lines, and these notches that people get as they get older right on each side of the chin. So the chin gets pointy, the jowls fall, because there's this loss of fat right in the central part of the chin. And placing fat in all these areas puts everything back, plumps everything back, volumizes, has a stem cell effect that really is a million times better than
one of the things that help me
before.
understand this, you say that there's a side effect of like rejuvenation in the surrounding area when you add fat.
More than volume. One of the things that fat does, like fillers, is establish volume. So how does it live? It lives by getting its own blood supply. It actually sends signals out from stem cells that are in fat to the body that says, I need a blood supply. So blood vessels grow in to nourish and allow the fat to establish itself and grow.
Okay.
The blood vessels that grow in have other magical effects. They make the skin look better. They make small, fine lines in the skin overlying the fat look better. They make the skin look healthier. They have effects on healing if people have scars or have abnormalities in the skin or even ulcerations. Stem cells from fat grafting has been shown to help healing and promote the healing of ulcers that otherwise haven't been able to heal.
Okay, so what is it? Is it more women that are doing this? Some men?
It's more women. It's maybe 80% women to 20% men. But what's happening that's very interesting is we are seeing more men, particularly for fat transfer. Why? It's not really a surgery. It's more of a procedure. So they don't see it as an operation. There's no cutting. There's no sewing. There's no stitching.
So are the men coming in for under the eyes?
Absolutely.
So bags under the eyes.
They come in. They want, I've got hollows under the eyes. I look tired.
Yeah.
I'm an executive. I'm dating. I want to look young with my children. I want to be active. I play football. I'm on camera. There's a million reasons that they look in the mirror and they go, well, gosh, I'm not seeing what I remember in those pictures. I'm not seeing the healthy, happy person. I've got dark circles or I've got hollows under my eyes. It's remarkably easy to fix. It's a 40-minute solution.
Is that right?
Permanent.
Okay, so the guys that are coming in, because nobody wants to look, especially men, I think, that you don't want to look like you've had anything done.
The purpose, the magic of fat, the magic of volume restoration is not to make people have a fat face. What we do is they bring in a picture, I go, well, let's get you to look like this. And they're over the moon because that's all they need. I don't want people to have rosy fat cheeks or big square
So you
jawlines.
could take a guy that looks tired now to rest it.
That's what I do.
Okay, you know, I was telling you that a friend of mine who's a pain management physician, she's 50, but she had tired eyes under her eyes. Saw her, just interviewed again, unbelievable. I mean, the difference between looking exhausted or her age, and now she looks about 38, 39 years old. I said, you had something else done. You know, she said, no, just a little bit of real fat under my eyes. So do you see that? Do you see people that you know, they're in their 50s, it's a huge difference by just adding volume?
Especially adding volume in the eyes is the key, because it's the windows to the soul. When we see tired eyes, when we see the hollowing under the eyes, it's fixable. It's fixable so quickly and so easily. And the same thing here. People will come in and think they need big surgery. They're expecting big surgery, and I go, no. Let's just have a nice plan.
Yeah, because you're a plastic surgeon. I guess the fear would be you go to a plastic surgeon he's thinking surgery every time.
Well, that's really how we make our bread and butter. But what's more important is establishing a good relationship with a patient. And when a patient comes in and they think that they need a big deal, a big overhaul, and I say, let's just do something small, see how you like it. And they like it, they'll come back. I don't worry about that. I'm more worrying about establishing a good relationship with the patient, having a happy patient with a fabulous result. Everything else takes care of itself.
Okay, so under the eyes, over the eyes, and you say you're doing also the forehead, or that area. What are you doing there?
There's two great new areas that we're doing that really are wonderful. The first is the hollows of the temples. And if you start looking at people, it's not that noticeable unless you tune your eye to it, but it's very common to see people get very significant hollowing right here in the temples. And the other thing is women and their earlobes. I see women all the time, they come in, my earlobes are collapsed, the holes are too low.
Is that right?
They're shriveling up like a prune, and just the fact of putting a little bit of fat and volume in the ear makes the earrings stand out, the ears stand up. It's beautiful. It looks like the young ear. And I tell them it allows the ear to hold a bigger diamond so their husband can buy them larger new earrings for them.
What are the misconceptions about adding volume with their own fat? Any out there that aren't true?
The biggest misconception about fat volume and fat transfer is that it's not permanent, that it's temporary. And that's really been a kind of a problem because the surgeons haven't done it properly. And I understand that if you don't do something well and it doesn't work, that you tend to blame everything except yourself. But it really is a technique-dependent procedure. If you ask me to play the piano, it's not going to look
because I hear doctors that will say, yeah, the problem with fat, it doesn't last that long, and only 30% will take if you're lucky. Is that just not true? But also, the person that told me that doesn't do it. Is that the Restylane salesman telling them that?
The Restylane will make a lot more money. It's a lot more valuable to lease a car.
We'll be positive, by the way, about those companies because we interview people about those, and I know that they work. But tell me about that, where they say only 30% last.
I tell people, buy the car, don't lease the car. Have something that's long-lasting. With fat transfer, there is not 100% survival. It depends on where you place it in the body. And so some places there is a 30%, some places there's a 50%, some places there's a 70%. Well, how do we overcome that? You put some extra in. I mean, it's not nuclear science.
And what about maneuvering it? Because, one of the things, and, we talked on the phone, and I was excited after that phone call. I'm going, that's what I need. And, but, I don't want to be puffed out. So are you able to, what do you do? When you put it in, you kind of mold it with your hands? How does that work?
The wonderful thing about the fat is that it's a real-time process. I'll put a little bit in, I'll mold it, and I'll look at it, and I'll go, well, let's put a little bit more. It's like painting. You add a little bit of color and a little bit of color. And in the eyes, when you're done, you're done. The take in the eyes is really very high. So you don't want to overdo or have someone leaving the office with the eyes looking overdone. Or
so somebody that had a blepharoplasty, is that how you say it? Maybe they look skeletal or cadaveric, as you say. They're the ideal candidate.
Yes, and back when we last talked, people were talking about taking fat out of the eyes, taking fat out of the upper, taking fat out from the lower eyes to get rid of the puffiness. Well, guess what happens? You look at them 5, 10, 15 years later, they're cadaveric because they needed that fat to look young. It just was puffy. So now there's a whole group of people who have had what we consider to be destructive blepharoplasties that we can fix in 40 minutes with the fat transfer.
But couldn't somebody argue that they're over volume, too much volume on the face? Because I feel like I could spot it. Now that I've been interviewing plastic surgeons, I see it and I think, I don't know about fillers because it's overdone. It's puffy face.
Beverly Hills and Southern California, even where you are here, is the best and the worst plastic surgeon you'll ever see in the world. The worst and best plastic surgeons and the worst and best plastic surgery outcomes. And I'm the first to admit there are grotesque, overfilled, crazy tight...
Is it the eye of the surgeon? Is your take? My take is I think that the doctors like it or that the patients are driving the procedure.
I'll tell you exactly what it is. When Botox first came out, you saw this whole Stepford group of women who were completely paralyzed in their faces. Why? Because they went to the doctors and they go, well, I don't want to be able to frown. And they put it in, they go, well, I can still frown a little bit. So the doctors overtreated them. because it went through this honeymoon phase where they wanted to Botox everyone and put too much Botox in everyone. That's gone now. People are appropriately Botoxed.
They want a little expression.
You have to have a little expression.
Okay.
You have to know when your wife is mad at you. But you also don't want to be overfilled. And I think that as people are learning about fillers and as people are learning about fat transfer and the power of fat.
So at the beginning you overfill.
Yes. The surgeons are overdoing it because they don't have the experience to know exactly how
many
much
years
to
have you
put
been
in.
doing this?
20.
20 years.
Over 20.
So
I've been doing liposuction over 20 years.
You've been adding fillers, adding volume to the face for 20 years?
Yes, yes.
Is that right? And how much better are, huge learning curve?
Huge learning curve. I'm still learning something. I just showed you earlier an article that was just published that I was talking about my current technique today, which is different than what I was doing 6 months ago.
Now, really, I should mention, because I even talked to one of the doctors from the doctors, and everybody respects you as the plastic surgeon that gives natural results. With facelifting and things like that. Is it the same with adding volume?
Adding volume is part of getting the natural result with facial surgery. And I've been just doing it longer. Maybe I'm older, maybe I'm smarting.
How much technique? Like 80%?
Yes. It's
or artistic, I should say. How much artistic? Is it 70% art, 30% science?
Fat transfer is much more art, I feel, than science right now. And I think that's why a lot of doctors don't do it.
Interesting.
You need a breast implant, you make a space, you open the box, there's the breast implant, you put the breast implant, you're done. There's nothing superbly artistic about placing a breast implant within some confines. However, when you're adding something to the face, you're shaping the face in 3-dimension and you're changing it. It's like a rhinoplasty. Rhinoplasties are difficult. A lot of surgeons don't do them or don't want to do them because they're frightening. You have total power of altering, changing, and making the artistic decision as to what really will look good for that person.
Do you see the end result?
I always see it in the room when I meet them.
And wow, this is going to be good.
Yeah, I know it exactly. And my job, and it's not always easy, is finding the words that my brain sees to describe it to the person so they can see it. Otherwise, they can't come on board.
We're going to take a quick break, and we're going to talk about how you're using fat transfer for the breast, creating cleavage, filling in ripples, lumpectomies, things like that. You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. We're talking about fat transfer and its regenerative power on the body. We'll be right back. You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. We're discussing fat grafting, adding volume, your own fat to your face, to help you look younger and refreshed. With us, we have board-certified plastic surgeon, Dr. Larry Koplin. Okay, so we've talked a lot about the face, and you love fat to the face. You're not a big fan of the artificial fillers.
Not at all. The wonderful thing about the fat is that when you put it in, you can move it around, you can let it go where it wants to go. It's almost doing it itself, but I have to warn you that it's technique dependent, and it takes a lot of time to get the confidence to know how to make the fat properly, put it in the syringe, place it properly, mold it. It's a very much technique-dependent thing. Find someone.
So what do you ask your surgeon? I mean, what do you say? How often do you do this? How many times have you done this?
I like it when they tell me, when they ask me, because I say I've been doing it for 20 years and I have thousands. I mean, I have over 2,000 cases that I've done.
Okay, so with the breast, what are the applications that you're using it?
Let me tell you exactly what a day would be like in my office. I'll have 2 or 3, 4 women who will come in who already have breast implants and they have problems with them. I go, are they hard? No, they're not hard. What's wrong? Well, they look like breast implants. They're rippled. You can see the edges. They're wide apart. It looks like someone put a bag into their small chest, into their breast. And up until a couple of years ago, Randy, there's no cure. There's nothing to do to make that better. We would say, well, gosh, you can take them out, or maybe making them bigger might make them. They say, I can't wear clothes, I can't wear a swimsuit, I can't wear cleavage, I'm embarrassed. Anything I wear that shows off my breast shows off a rippled or an edge of an implant. Well, guess what? The power of fat is to take the fat, and we can actually use it, just like we do in the face, to make a covering over the implant. So
interesting.
What are they missing? They're missing breast tissue and they're missing fat. I can replace that with the fat and camouflage the implants. I can make them look closer together instead of looking like there's nothing and all of a sudden they start. We can cover the breastbone so you don't see the
So the wide
bones.
cleavage, thin women, I mean you see this,
Unfixable
a very wide
before.
cleavage.
The only
you
way
bring
to
that
fix
in?
the only way to fix wide cleavage before is to use a gigantic implant. But if you do that, it's up in your collarbone, it's up under your arm. There's no way to soften it and fill it in except now we use fat, and it's brilliant. It's beautiful.
Couple
it
procedures?
Looks great.
I mean, over time, I mean,
I do one, maybe two. It's so much better in one. It just depends on
what about the response? What about the response? What are they saying?
They're over the moon. They're over the moon, and I'll tell you why they're over the moon. First of all, I have to steal the fat from somewhere. So wherever I tell them, it's like Robin Hood. You steal from the rich and you give to the poor. They go, well, gosh, can you take it from my tummy? Of course I can take. Can you take it from my
So a little
thighs?
belly button fat, you just take it from there, give them cleavage with it.
Correct.
Interesting.
And so you can take it and then you can just blend it. Imagine you have an implant and it has edges. Well, I can blend all around the edges of the implant. I can blend over where you might see any rippling, and you can make the implant look like a
How do
natural
women hear
breast.
about this, by the way? Because you don't advertise this kind of stuff. Is it just word of mouth? Right now, on the you say 2 or 3 women may come in a day and complain about this.
I just showed you an article that I had published talking about this. You're just starting to see now in the literature and in the media this is a concept. And I think it was because it was such a black sheep concept before in the 80s that it's coming in more slowly than it should. We do breast augmentations completely now with fat. We have women who come in who've had, say, a lumpectomy. There's a
Not every time.
missing.
Not every time.
Not every time, but if they request it and they have enough fat in other parts of their body, it's an option. We talk about you can have implants or you can have fat. We never had that to offer before. It's a whole universe.
So adding
that didn't
cleavage,
exist.
and by the way, if you're just tuning in, we first part of the show we talked about adding your own fat for loss of volume in the face.
Yes.
And the powerful effects, long-lasting, permanent solution, and now with breast cleavage, filling in ripples. Now, what about the cancer patient? Because we're almost out of time.
Mastectomy is almost a thing of the past. What do women have if they find out a bad diagnosis? They usually have what's called a lumpectomy. They'll take out a piece of the breast, and then they get treated with radiation and or chemotherapy. Well, now they're walking around with a dent, which could be a significant dent in the breast.
Okay.
Well, an implant won't fix that. An implant will
What
give
did they
you
do in the past for this, by the way? What have they been doing?
commiserate with their other friends who have
So not much.
deformities. There's really nothing to fix that because you can't put a lump of silicone in, and if you put an implant in, you just get a big breast with a dent in it. Well, now we can custom fill that deformity with fat, and breast is approximately between 20 and 80% fat anyway. So we can be very specific and very anatomic in just filling in and letting them feel whole again. They've got the stigma of something that they're hopefully cured from, and now we can take the stigma away and make them feel beautiful and feel young and feel attractive and wear all the things that they were able to wear before. It's wonderful. It's a miracle.
Good. Now we're out of time. Okay, so let's end with frequently asked questions about fat transfer. What do they want to know every time on the consult? Okay, so they've heard about it. Now they're going to you. What do they want to know?
First of all, they want to know where all the places to put it. And one of the things that I tell them is I use it a lot on the hands. And women who we've done a beautiful, natural rejuvenation of the face, they go, I've got spots on my hands, I've got veins, they're all bony. Well, we can do some laser to get the spots out and then fill in, almost like spackling, over the blood vessels and in between the tendons and get a soft looking natural, not a mitten, not a glove, just enough to make it the way that they used to look. Earlobes, as we talked about. Everywhere that you can imagine some type of deformity, I'll tell you another place that it's wonderful for, is women who have had liposuction that hasn't gone well, that hasn't been properly done. And for the lumpy part, we can do a little bit more fat removal, but they have a lot of indents and gouges and irregularities.
Interesting.
And the
you
fat
can smooth that out?
It's perfect for it. It's
really
what is supposed to be there. Now we have the magic and the technology of just simply replacing it, and it's wonderful. It takes people who really can be crippled from poor liposuction outcome and make them look wonderful again.
Okay, I don't want to put words in your mouth, but if you're going to get Restylane, Juvederm, nothing against those products. They're effective, etc. But you don't like them. Before you get that done again, find out more about fat transfer. Or don't get it at all.
There's no fat like your own fat. And like I said, in the long run, it's much more cost effective to do the fat. You're leasing a car when you're using fillers. You'd get nothing.
That's a good point. That's a good point.
6 months later, it's gone.
I mean, if you're in your 40s getting fillers, and I know these people, that you're going to be getting fillers forever.
Well,
right?
Those angry people come into my office and they go, I've spent more than you quoted me for the facelift on 10 years of fillers. And I go, well, sorry, let's stop that. Let's get you have something that's natural, that looks like natural volume. It's beautiful. It ages with you as opposed to going away from you.
Wow.
And in the long run, it's much more cost effective.
So this is the future. When you hear adding volume to the face, it'll be with fat.
It is the future.
And you don't have to wait around. You can do it now. Look for someone with a lot of experience.
Yes, this is.
Do you do this every week?
I do this probably 10 a week. This is my main operation. Why? If I do liposuction, do you want me to throw the fat away, or would you like me to put a little bit in a few places? We'll go, please use it. If I do facial surgery, I need to put some in. If I do breast augmentation, would you like me to put some around the breast?
So don't throw away the fat.
Don't throw away the fat. It's too valuable.
Well, good. Excellent. And this is all on your website?
Yes.
And they could visit your website, and we'll also have you on our website. So I want to thank you for coming on the program.
It's my
Very
privilege.
good. Great
Thank
stuff.
you, Randy.
Great stuff. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to show this or send this to a friend, you could go to our website at wellnesshour.com and just put in fat transfer or Dr. Koplin, and you'll find it there. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.